Welcome to the Financial Finesse Podcast, where we'll be discussing tips on how to handle your money and life with skill and style. Your host, Cathy Curtis, CFP, has been helping make finance accessible and intriguing for women for almost 20 years. You'll get savvy, actionable ideas listening to her conversations with some of the coolest and smartest women on the planet. And now, here's your host, Cathy Curtis.
Welcome to the Financial Finesse Podcast. I'm your host, Cathy Curtis. My guest today is Danielle Roberts, founding partner at Boomer Benefits and author of the best-selling book, 10 Costly Medicare Mistakes You Can't Afford to Make. Danielle is a well-known professional in the Medicare industry, having personally helped thousands of people with their plan decisions. She also specialized in Medicare-related insurance products for over 15 years and is a member of the prestigious Forbes Finance Council. As a Medicare supplement accredited advisor, Danielle is well-versed in all issues currently affecting Medicare. She is also a regular contributor to several publications and has written extensively about Medicare and Medigap plans. In this episode, we talk about all things Medicare, including the common mistakes people make and how to avoid them. Whether you're new to Medicare or simply want to learn more about it so you can make an informed decision this open enrollment season, this episode is packed with useful information and unique insights. As always, you can find more information related to this episode and additional resources in the show notes at curtisfinancialplanning.com. Thank you for joining me on my podcast, Financial Finesse. I'm super excited that you're here because I know for me and for my clients, Medicare can be like the black void of information. It can be so confusing. And you have 18 years of experience in the industry. And you also wrote a book, The 10 Most Common Mistakes that Medicare beneficiaries make, right?
Yeah, pretty close. 10 costly mistakes that beneficiaries can't afford to make.
Right. There you go. And I'm sure, you were already an expert and then you wrote a book on it, which makes you even more of an expert because you had to do all the research and make sure you had everything right. And so you're the perfect person to talk to about Medicare. I wanted to start by just talking about a couple of my little pet peeves. And I'm sure you hear about pet peeves about Medicare all the time. But why did whoever decide to name Medicare by the alphabet, Medicare A, B, C, D? First off, A has nothing to do with hospital. Why not Medicare H? And then you throw in Medicare C, which really is a whole separate thing.
Yes.
So if you have A, B, you don't need C. And then D is the only one that somewhat makes sense because it's a drug plan. Who did that and why do you think they did that?
It's such a great question. And it's funny because I actually cover this we do a webinar at Boomer Benefits several times a week for Medicare beneficiaries. And I cover this in the webinar to explain how Uncle Sam really got this wrong because they have Medicare parts, which have A, B, C, and D. And then you can add to that Medigap plans. And instead of using Roman numerals, they labeled them A, B, C, D, F, G, K, L, M, N. And this is endlessly confusing to beneficiaries. So the good news is when you talk to a broker or an expert like myself, if you say the wrong word, if you call Plan G a Part G, we're usually going to know what you mean. But the history of Medicare goes back to in the 60s at the time Medicare was created. They modeled Medicare after the old Blue Cross and Blue Shield style of plans. And those plans were a hospital side and a medical side. And so I think at the time it was probably logical just to use the alphabet because they couldn't have foreseen the advent of Medicare Part C, which didn't come onto the scene until 1997. And Part D is even newer, 2006. So they maybe at that time didn't realize that at some point there would be needs for change. And maybe they could have labeled outpatient medical M, or like you said, hospital H, but that's the way Medicare is, and it has to do with the way plans looked that were very popular back in the 60s.
Or not even use the alphabet, just say hospital, Medicare hospital insurance or Medicare outpatient.
Yes.
To me, that would make, but people who set these things up don't always think about the end user. I mean,
So
you can
true.
see so many examples of that, really.
Yeah.
Okay,
Right.
so another one before we get into a more general discussion is the marriage penalty with Medicare premiums. So someone's married, the one spouse makes 25,000, the other one makes 200,000, but they both pay the same premium. There's those IRMA charges. So if they were single, the one making 25 wouldn't have an extra charge on their Medicare premium, but they do when they're married.
Yeah, they do. So when you have enrollment into Medicare Parts B and D, those parts have base premiums, and then there is an income related monthly adjustment amount that can be added on top of that based on income. And there is a single column where you can look up your income if you're a single filer, and then there is a married column where you can look up your household income, and that is correct. So let's say that you had a household income of 300,000, you would pay somewhere in the neighborhood of $428 each for Medicare Part B. And so there isn't a way around it. They have a column for married filing single, but it's actually even a higher penalty if you go that route. And so my theory on this is the government likes to get its piece. You know, when in America you earn more, you pay more, and they weren't going to miss out on that little bit to help Medicare solvency, of course.
Yeah, right. I guess you can look at it that way. It keeps it healthy for all of us, but it just seems unfair to me.
Yeah, I would agree. Mm-hmm.
Yeah. Okay. All right. So now we're going to get into a more general discussion, and the way I want to frame it is, we're going to take a 64-year-old person, let's say a woman, who knows that she needs to start thinking about Medicare, but really dreads it. She doesn't have an advisor to help her, and she's getting all this stuff in the mail. So what is the first things that this person should do and think about?
So the good news is she's 64 and she is thinking about it, because certainly we have people call us when they're 65 and they're already in their initial enrollment period or have even missed it and they haven't started to learn it. And of course, you know, this has to do with, it's Medicare. It's this beast of a topic. It has 4 parts, 10 supplements, thousands of drug plan options. And to make matters worse, when you turn 64, you'll start getting telemarketing calls from 20 or 30 people a day trying to solicit your Medicare business, and you'll get a stack of mail and you won't know what to keep or what to throw out. What's a solicitation? What is something from the federal government that I should keep? And so that stack just grows larger and larger with time, and it's very frustrating and overwhelming. And so what you see is this total paralysis and sometimes a dead stop, no action whatsoever, because everyone is so afraid of making a mistake. And the best thing you can do, yes, it is.
Yeah.
Oh, absolutely. I have seen incredible stress over this for some people over the years. And for some people more so than others. You know, somebody that is married and has a spouse and they've both, had opportunity to do some reading and compare notes, that's one thing. But sometimes you have someone that is single that is totally overwhelmed. Maybe they're widowed and recently lost a spouse who used to handle the insurance part of things. We run into people like that all the time, and it can create real fear.
Or the other thing is to computer savviness, right? Because the easiest way to learn about these things is to go online. And I mean, even some 64-year-olds don't want to I know I have clients that don't, they're not internet savvy.
Yeah, that's right. And back in the day when I started, everything was paper. There was no Facebook. I mean, we barely had Google. You would mail out an application and someone would fill out a paper application and send it back. And you can still do that today, although it is a far less popular means of enrollment. Almost everything is online. So actually, one of the reasons that we wrote the book, the 10 Costly Medicare Mistakes book, was partly for that reason. the first reason is we saw so many people coming into Medicare and having that fear and paralysis and not making a decision because of a fear of mistake. And then when we looked at all the people we had helped over the years, we could see the trend of people coming in, and they do tend to make the same mistakes as the people that came before them. So we wanted to identify what those mistakes were and how can people avoid it. But the other part of that was something that someone can order, or they can go to Barnes and Noble in person and get this book and have it in their hands if they're not computer savvy. We produced a book with specifically large print to make it easy for people to be able to read through that. And there's always the online option to do additional research, but we have had some people over the years that have commented about, I'm not really computer savvy, and this was helpful. So there is fortunately reading out there that is available. So while a lot of information is online and you're not very savvy, there are a number of books written about Medicare, and you can also contact Medicare if you need a hard copy of the Medicare and You handbook. And so people,
that thick book. I think your book would be the better choice.
That one's not so fun to read. It's certainly the Medicare and You handbook is a little dry. I think mine is probably organized in a way that's maybe a little more palatable. But you're absolutely right. Everyone,
it's a hardcover book. I'm sorry, I don't mean to talk over you. It is a hardcover book. You could buy it in a bookstore.
Yeah, you can. There's a Kindle version if you happen to be an e-reader person, but it's a paperback. And so it's a pretty meaty book, and it will give you all the basics that you need to know. And something else I recommend for people is sometimes it's good to learn in more than one format. So maybe you start off doing some research online and then you get the book, or you start with the book and then you attend a webinar, or you go on YouTube and you watch some videos about Medicare. We have a channel there for Boomer Benefits, but lots of other agents have great videos out there. That's a good place to learn. And so taking enough time, to get back to your original question, starting early at 64 or no later than 64 and a half, to give yourself time to digest this information, because we know that your whole life you've had employer benefits decided upon for you. Most people in America have very few decisions about insurance when it comes to health insurance. They choose their auto insurance and they choose their homeowners insurance, which are things they're very likely to never have a claim on, especially homeowners insurance. But they don't choose their health insurance, and health insurance is the one thing they're guaranteed to have claims on. So it's really this backward system. But when you're whole working life, your employer has chosen insurance for you, or maybe given you two options. Maybe there's a high deductible and a low deductible. Maybe there's a PPO and an HMO, and they're paying a portion of the premium, and then you have payroll deductions. But you're usually choosing between very limited options. And now all of a sudden, you're thrown into this national healthcare insurance system with all these moving parts, and you're supposed to figure it out. It can be really intimidating.
Yes, and I want to make another point too. You're talking about employees specifically. What about self-employed people? And a lot of self-employed people work beyond age 65. They have their own businesses. They love what they do. There's a lot of confusion around, well, what do? I don't really need Medicare right now. I've got my own plan. And there's so much fear around that. Am I going to make a mistake and not enroll at the right time and all those things?
Yeah, and especially today with people working much later, as sometimes we have people that aren't even enrolling in Medicare until their 80s because they have either been self-employed or they just love to work. And so they delay their enrollment. And there are questions about, if I do delay my enrollment, are there penalties? And of course, the answer is it depends. And so it's really important that you get those answers correct so that you don't fail to enroll in something that you should have, and then find out down the line that you have a giant penalty that will follow you all your life. And those are the kind of mistakes that people really dread making.
Yeah, that's another one of those Uncle Sam things where they'll get a piece of you, right? With those ongoing penalties. It's just, to me, egregious, really. But anyway, that's another one of my pet peeves. Okay, so the 64-year-old has to get super informed in whatever format makes the most sense. Online, paper books, whatever.
Right.
Okay.
That's where you start. And then write down your questions, right? So you're going to do all the research that you could possibly do, and there's going to be some holes in that information. And then that is when you want to reach out to a broker or an expert who specializes in this insurance, and that's where you go with those questions. So For example, at my agency in Fort Worth, with all of my team that is there, when someone calls in, a lot of times they have already either read the book or maybe they've just done their own research on Medicare.gov. They have done some research, but they're going to come in with a list of questions. And so you'll want to meet with an insurance agent who specializes in Medicare. You don't need to do this in person. I find that a lot of people really dread that part. They don't want to go and sit in front of someone and be sold. And that's not really how Medicare insurance works anymore. Most of this is always done over the phone, which most people find far more comfortable.
Mhm.
And you can ask all those questions. And so it's not unusual for someone on my team to spend the first hour that they ever speak with someone only going through the basics. So someone will come in and say, I've done this, I understand this much, but I have these questions. And so they're almost doing like a little bit of a Medicare 101 with that person, just filling in the holes and sometimes correcting something that someone got wrong to make sure they get on the right path. And that knowledge is really important because where people go wrong is they have the stack of mail, 98% of which is advertisements for Medicare Advantage plans. And they
Mm.
start trying to learn there before they actually understand their government benefits that they're entitled to, that they've worked for all their life, that make up the base of their coverage. And you really have to understand the parts of Medicare, what they cover, what they cost, and how and when to enroll in them before you can make a good decision about enrolling into a Medicare supplement or a Medigap plan or your retiree coverage. Learning that foundational base coverage that comes from Medicare A and B, and then the options for C and D, that's your starting point. And you want to get
Okay,
really well versed in those first.
let me step in real quick because already I'm seeing the A, B, C, D and all that. So, and you said this, you made one point just a little bit ago. Most of the mail you get will be from Medicare Advantage plans, which is called Part C.
Yes.
Now, why? Let's explain why that is.
So when you enroll in a Medicare Advantage plan, a Medicare Advantage plan is a way for you to get your Medicare Part A and B and often D benefits through a private insurance company that operates a network in your local area, such as an HMO or a PPO plan. When you enroll in those plans, Medicare pays the plan a significant amount of money, $1,000 a month or more. They can also qualify for giant bonuses that get added to that to take on all of your risk and deliver your health insurance. So let's say that Medicare Advantage plan takes in $15,000 a year from Medicare because you enrolled in that plan. Well, if they can deliver your health care for less than $15,000, they're making money, and they make a lot of money. There are more healthy people always than there are sick people, and these Advantage companies make a fortune. If you've done any look at the stock market with healthcare in the last few years, I myself have hundreds of shares of United Healthcare stock because I'm so familiar, and I have seen the trajectory of these kind of healthcare stocks. They make a lot of money. So of course, they're going to heavily market you to choose an Advantage plan rather than original Medicare and a Medigap plan, because they are then going to get paid so much money by Medicare, and that's how they profit. So that's why most of the advertisements you see will often be for Advantage plans, but you'll get some for Medicare supplements and also Part D drug plans as well.
Right. That is such a clear explanation. It really is. But it's also making it sound like Medicare Advantage may not be the best choice.
It depends.
Okay. Okay.
Yeah.
So I really do want to get into that. The differences. And is this a good time to do that?
Yeah, sure. I can kind of give you the breakdown. So you have two routes you can go with your Medicare. Let's just first say you're no longer working. By this point, you've retired and you don't have retiree coverage provided by your employer or TRICARE for life or federal employee health benefits. Those are all decisions that you're going to make with your former company that you worked for. But you are one of the 85% of Americans who have original Medicare and will be making your own decisions about your secondary coverage, because on average, Medicare covers about 80% of your bills. And then there are deductibles, copays, and coinsurance that you pay, which is why people buy either a Medicare supplement or an Advantage plan. So if you have original Medicare Part A and B, you are now going to decide whether you want to stay with original Medicare, which means Medicare itself is receiving your bills and paying your bills. And then you add a Medicare supplement, also called a Medigap plan, same thing, just two different terms, that picks up that other 20%. And depending on which plan you choose, fills in some of those deductibles that you would have to pay. For instance, in 2023, if you go in the hospital, there's a $1,600 deductible. A lot of people want a Medigap plan that's going to pay that for them.
Okay.
And then because Medigap plans came out in the 60s, which was long before Part D was created, you would also add on a standalone Part D drug plan, which you can think of sort of like a pharmacy insurance card. You only get it out at the pharmacy when you're picking up outpatient medications. Now, the reason that if someone chooses a Medigap plan, usually the primary reason is freedom of access, because these have no networks. So you can use those plans at any provider in the nation that accepts Medicare. You don't have to pick a primary care doctor. You don't have to get a referral to a specialist. And if you develop a dread disease and you live in Texas, but the foremost specialist in the world is at the Mayo Clinic in Arizona, you can go there. So people buy that because you don't have to ask them, do you take Blue Cross? Do you take Humana? You say to your provider, do you take Medicare? And if they say yes, any Medigap plan from any insurance company will pay just like it's supposed to. So
as opposed to Medicare Advantage, where you can't go to any specialist, and you have to get referred by your primary care physician, and you have to have one of those, right?
It depends.
Okay.
So first, let's wrap up the Medigap side. Thinking about if you added on that Medigap plan and a Part D drug plan, this is the most comprehensive coverage you can buy because Medicare gets the bill, Medicare pays its share, it sends the remainder of the bill to the Medigap company who then pays its share, and you are only getting a bill if there's anything left over, which many times there isn't. So that type of coverage costs more. You're paying a higher premium to have less back-end spending and more freedom of access. Medicare Advantage plans, just like you asked, are the opposite. So with these plans, they operate a network in your local area, HMO, PPO. We've all been in these plans before. We know how they work. And so you are basically going to pay a lot less for your plan. Many Advantage plans have what we call a zero premium, which we can certainly get into. But those plans have much lower premiums because you agree to use their managed care network, and all those providers are under contract providing their services at a discount, right? So that's one thing. And you also, you are sort of giving up some of that freedom of access because if you have an HMO, of course, you are going to choose a primary care provider. You're probably going to need a referral to see a specialist, depends on the plan. And a lot of them, there's no coverage outside of the network except in emergencies. So a Medicare Advantage HMO really is a good plan for someone that's going to stay local to home. They don't do a lot of travel. They wouldn't go to the Mayo Clinic in Arizona for treatment. Even if they did get sick, they would treat locally. Those plans might be a really good fit for someone there. Now, someone else might say, well, I can't afford a Medicare supplement, but I also don't want to only treat locally. They might look at a Medicare Advantage plan that operates a PPO network, which we know is a little more flexible. Of course, you have the best copays when you are in the network. But if you go outside the network, you at least can do that. You're just going to pay more. And the clinic or hospital or doctor has to agree to bill the Medicare Advantage plan, and not all Medicare providers will do that. So the lower premiums that you pay up front for a Medicare Advantage plan are because you're going to play by the network rules, and you're going to pay copays, coinsurance, and deductibles as you go. So for a lot of years, we saw with Medicare Advantage plans, they were really popular with people who come in, they're very healthy. And that person might say, why would I want to spend $120 or $200 on a Medicare supplement when I can enroll in this Advantage plan over here that doesn't charge me anything at all? And the Advantage plans have extras built into them because they get paid by Medicare. they want to make their plan as attractive as possible to get the most people to enroll in it. And so they might build in things like dental, vision, hearing, gym memberships, over-the-counter catalog for vitamins and supplements, and you can spend $50 a quarter on that. They have some of them have safety modifications for your home. You can have bathroom grab bars installed. They're all going to be a little bit different. So imagine somebody coming into Medicare who has been kind of like my dad, who for probably 40 years never visited the doctor, like didn't miss a day of work in his life. He was looking at, why would I want to spend this money on a Medigap plan when this over here is basically free and I get all these extra things. And then as time has gone on, and Medicare Advantage plans have improved and built in more and more of those extras and expanded their networks and their network reciprocity, they have become more appealing. And now today, statistically, 51% of people on Medicare are enrolled in Advantage plans. And I think we will continue to see that trend just because there's so much pressure on the budget of someone living on a fixed income in retirement, and where you have money and dollars to spend. It's really hard to turn down something that is a lot cheaper that you could sort of just pay as you go, as opposed to having something where you pay much more upfront, whether you're going to use it or not.
Do you think some of that could be attributed to the heavy marketing from the Medicare Advantage companies too?
Oh, absolutely.
Yeah.
And on that topic, let me please say, don't ever enroll in any plan because you are watching a TV commercial where they have an aging sports celebrity who tells you about this amazing plan where everything is free and we're going to send you money. And tomorrow morning when you wake up, there'll be a pink Cadillac in your driveway too. Run for the hills.
Yeah.
Those commercials actually are, those companies that run those commercials came under quite a bit of fire this year. The Senate Finance Committee actually wrote and sent a letter to CMS about this, Centers for Medicare and Medicaid Services, because a lot of times what those commercials are doing is they will tell you about a benefit that exists in one plan in one state if you happen to have Medicare and Medicaid, because your income is so far below the federal poverty level or a percentage of that poverty level, you're actually getting all these aid dollars from Medicaid. So of course they can make those benefits much richer from when they're getting paid by Medicare and Medicaid.
Yeah.
But you call and you don't live in that county and you don't have Medicaid. You're an average American, middle-class person. You're not getting any special benefits from the government for income. They'll say, oh, well, you don't qualify for that plan, but let me tell you about this other plan, which, by the way, has a lot less benefits, but it's a really cool plan and it's available in your area, right?
What percent of Americans are on Medicaid, just as an example of how?
I don't actually know the percentage. It might be something like 10%. I actually am not sure.
But fairly low.
Yeah. So to qualify for Medicaid, if you were living on just Social Security, and that is literally the only income that you had, you might qualify for Medicaid. So I have run into many clients over the years whose work history was good enough that even just the amount of money they get from Social Security puts them over the limit for Medicaid. But if you do have anyone listening that's low income, looking into applying for Medicaid, it's free to apply. And if you think you have income and resources that are low enough that you might qualify, it can be very helpful. It will help to pay for your Medicare Part B premiums, which in 2023 are $164.90 a month. So that's a pretty significant savings, but it also at certain levels can help to pay for some of your copays, deductibles, and coinsurance that comes with Medicare. And so when you have Medicare and Medicaid, the coverage is actually pretty good, but you are limited, of course, to using Medicaid providers.
All right. Okay. I have a couple questions of following this conversation that we just talked about. What if you enroll in Medicare Advantage because you weren't fully informed, and then later on you learn about some of the disadvantages of that program?
Yeah.
Can you switch? And I know the answer is yes, you could switch, but are there any pitfalls to know about if you're thinking about switching? Can you go over that?
Yes, definitely. So in my book, Chapter 8, we call the big mistake, and this is about this issue. So you're new to Medicare and you're making your choice between a Medicare supplement and a Medicare Advantage plan. With Medicare supplement in most states, there are some states which have expanded rules, but in about 40 states, you have a one-time window, one time, that begins with your Part B effective date and it goes for 6 months. And that is when you can enroll in any Medicare supplement Medigap plan available in your zip code with no health questions asked. They have to issue you the coverage even if you were in the middle of being treated in a skilled nursing facility, racking up thousands of dollars of care every day. They have to issue you the coverage. Once that 6 months is done, thereafter, now if you want a Medigap plan in most states, you will have to complete an application. You'll have to answer a whole page of health questions. The underwriter will review your answers. They may have a telephone call with you. They will look at your medical records. They will look at your prescription records. If you're somebody that takes a couple of blood pressure maintenance pills, pretty good chance you're going to pass with flying colors. But what if you're someone with a chronic condition that's treatable but not curable? So something like rheumatoid arthritis or osteoporosis, you're going to have a hard time getting that coverage. So it's difficult. It's easy to start with a Medigap plan. And if over time you have rate increases and you decide you really wish you had done the Advantage plan, that would have been cheaper. It's very easy to switch from Medigap coverage over to Medicare Advantage because Advantage plans have no underwriting.
Okay.
Yeah.
All right.
You just have to apply during a valid election period. So that person might be on their Medigap plan, and then in the annual election period comes up in the fall, they can apply for an Advantage plan between October 15th and December 7th. They're going to get approved for sure as long as they live in the plan service area and they have Medicare Parts A and B. Then they would cancel their Medigap plan. Very easy to go that direction.
Okay. And but you can do that but if you decide couple of years later, I want a Medigap plan, you go through underwriting again, and you may have had some illness in between then that your premiums may go up more. So you have to be very careful with this.
Yeah, because if you start with an Advantage plan, or if you go from Medigap to Medicare Advantage, now if you change your mind, you can absolutely switch back to original Medicare during any valid election period. But to get the Medigap plan, you're probably going to have to fill out an application. Okay. There is one caveat to that, which is if you try a Medicare Advantage plan, the first time that you ever try any Medicare Advantage plan anywhere, this is a one time in your life exception, you have 12 months to change your mind. So if you try that Advantage plan and there's things about it you don't like, maybe you don't like the prior authorization process, maybe you don't like the network, or you've had more expenses on it than you thought. If you change your mind and you want to go back to original Medicare and go back to the Medigap plan that you had before, you can do that within that 12 months, and there's a special once-in-a-lifetime option to do that. And that Medigap company has to take you back, even if you have developed a major health condition in that time. But the thing about that is, most of the time when you go to a Medicare Advantage plan, you're spending much less money. Everything's great when you're healthy, right? Yeah. So the chances are you're probably not going to switch back to Medigap in the 12-month window. You just have to be prepared. What if 5 years down the road, suddenly you have cancer treatment or you need dialysis? You're going to be spending some money on your Medicare Advantage plan, paying the copays, coinsurances, and deductibles that are part of that plan up to the plan's maximum out of pocket. And that can be many thousands of dollars. So when we have people that want to choose an Advantage plan, we tell them all of this, unlike the sports celebrities on television, so that they know what they're buying. And we encourage them to start a rainy day fund. Take that $150 a month that you would have spent on a supplement, put it in a medical account that you don't touch for any reason other than a medical emergency. Now, if 5 years from now you need a joint replacement or you have some ongoing care and you're going to be racking up, hundreds of dollars in provider charges under your Advantage plan, you're not going to panic about it because you have money already set aside for that possibility.
Great way to do it. And
yes.
So the financial planner in me is going, yes, that is perfect.
Absolutely.
It's just like someone who doesn't want to buy long-term care insurance or can't afford it. Well, they're going to have to save for it because it's more likely they're going to need it.
True.
It's true in this case too. It's more than likely you're going to need something's going to come up as you get old. The body just doesn't stay 100% healthy up until your 90s.
Yeah.
So in your mind, is that a viable choice for some people to
Oh, definitely.
okay,
So the reason you see 50% of people choosing these plans is because the insurance companies make enough money on them that they over time have made them better and enriched them. And so if someone understands what they're buying, I at our agency, about 15% of people probably choose Advantage plans. And I think the percentage at our agency is low compared to the public for two reasons. Number one, we explain how everything works, and a lot of people like the idea of the freedom of access. And also, we do a lot of our marketing digitally and online. And so we're running into many people who are sort of middle class, upper middle class. They can afford a Medicare supplement. And we have people that go that direction. But even in that group, I see some of those 85% of people that choose the Medigap plan after a couple years, where every year you get a rate increase from your Medigap plan. But every fall, you're looking at those commercials and seeing how Sally next door is paying zero. You have
yeah,
more and more people switching over. But the people that go on them that understand how they work are like our clients. We rarely get complaints about them because we explain them so thoroughly up front, and we make that recommendation for the rainy day fund. Also, when you're shopping for a Medicare Advantage plan, some of the things that we do are we check to make sure your doctors and hospitals are in the network. We check to make sure the drugs that are important to you are on the formulary. And Medicare Advantage plans have a maximum out-of-pocket limit to cap your spending at a certain point. And in 2023, that limit can be no higher than $8,300. Well, $8,300 out of a pocket in a health catastrophe for someone on a fixed income is probably a lot of money.
yeah,
So the out-of-pocket maximum can't be any higher than that for in-network services, but we can look for plans that voluntarily make it lower. So we might find you a plan that has a $3,000 maximum out-of-pocket limit. Well, if you're on that Advantage plan for a few years and saving those Medigap premiums that whole time, now you have a year with a little bit of health spending. You've saved a lot of money in the meantime. And so there are a lot of people that look at it like that. And there are people that just flat out couldn't afford a Medigap plan to save their life.
right,
So Medicare Advantage for those people is a really important option. You don't want to be
right,
exposed to paying 20% of your bills forever with no cap like you would be on original Medicare with nothing else supporting it.
right. Okay. So there's a couple ways to look at it. Like someone who is wealthy, could choose Medicare Advantage, even though they could afford a Medigap,
Yeah.
because they can afford to self-insure.
Yeah, of
So,
course.
right now they're 100% healthy. They think I'm going to be healthy for the next 20 years. My parents were, there's no illness in my family. But then in the 20th year, some health catastrophe happens. Well, they're wealthy, so they can afford to pay
Yeah.
right? You can look at it that way. Somebody,
Yes.
I don't know if you have clients that do that.
Yes,
Um,
absolutely.
yeah.
There are people that do. Why would I want to spend that money? If something serious happens and I had a self-fund, I could do it.
Okay.
Another thing we see people do is they'll supplement the coverage. So they might enroll in a zero premium Medicare Advantage plan, but they'll spend $30 a month on a cancer plan to sort of shore up some of the coverage that might make them bleed into that maximum out of pocket in the event of a serious health condition. So there's a lot of different options that people can pair together. And if you do research ahead of time, you might find one of those to be a good fit for you that feels better than spending that money every month on the Medigap plan.
Okay, let me ask you this then too. If someone does have a history of disease or illness, in your opinion, are they always better off? Let's take the issue of affordability out of it.
Mhm.
Are they always better off with original Medicare?
In my personal opinion, thinking about my own parents. So, my dad is on Medicare. He has VA access. He could get his coverage through the VA if he wanted to, or I could put him on a Medicare Advantage plan. He's on a supplement. And the reason for that is because I know from experience that in many locations, VA coverage, you wait a long time to get the care. They don't have, sometimes the VA doesn't cover the medication you need. They won't prescribe it. So now to go outside to a civilian doctor, you're paying cash because you didn't enroll in Medicare. I had my dad enroll in Medicare Part A and B. We set him up with a Medicare supplement. And he also sort of pushed back on the drug plan. I don't take any meds. I'm fine. I'll just get them from the VA. And I was like, okay, I'll buy your drug plan. So he has a Part D drug plan. And sure enough, went to the VA, didn't want to sit there for 4 hours waiting for an appointment. He almost immediately started using his civilian coverage and then developed a health condition for which he takes two medications that aren't covered by the VA, which would have cost him around $740 a month. But because I got him a Part D drug plan, he paid $47 a month for those two prescriptions.
Is he thanking you?
I don't think he quite understands. He just knows my daughter is a Medicare expert. I'm going to follow what she says. But it hasn't stopped him from, on one or two occasions, calling me to say, I keep seeing this commercial, for this plan that's zero and it has the dental coverage. And I just tell him, Dad, I could put you on that coverage, but I would prefer not to. I like the reason for me that I chose that coverage is I wanted the peace of mind that if he did have a serious health condition, he would be able to go anywhere that he needed to.
Yeah.
And for some people, that's just not a concern. They're not going to go out of state to treat anyway, and they would get their care locally. If you remove that freedom of access from the equation, I think the Medicare Advantage plans can be a great fit for many people. But for him specifically, because of course, emotionally, he's my father, I want him to have that freedom of access if and when he ever needs it. And we need to consult some doctor somewhere that isn't in a Medicare Advantage plan or refuses to bill a Medicare Advantage plan. I want him to have that flexibility.
Well, don't you think most people, if they have a serious disease, they get diagnosed with cancer or something, they're going to travel. They will be willing, even though they say, no, I'm not going to travel for health care. They will travel if it's a life-threatening.
Yeah, they absolutely will. And,
Yeah.
Some of the facilities like MD Anderson down here in Houston, arguably one of the best cancer hospitals in the world, for a long time, they didn't accept any Medicare Advantage plans. And I'm actually not sure if they do now. My team could tell you, having worked with the products every day. But those are important things to think about. Like, if you did get cancer, where would you want to treat? Do you want to make a phone call to that particular hospital or hospital system to find out, hey, do you take any advantage plans? Which ones are they? So that you could get into one that's in the network if they accept them. And these are all the types of research up front that if you don't have this background knowledge, you don't really know those questions to ask, which is why it's never good to do this enrollment on your own. You want to work with someone who's a professional.
Absolutely.
You want to have also back-end support.
Will you make those phone calls for a person to find out if a certain Medicare Advantage plan
does
certain type of cancer?
So if someone comes into our agency and they're like, I really want an Advantage plan, but here are my concerns. So we're going to check to make sure the doctors and hospitals that they want to see are in that network. We're going to check to make sure the drugs are in the formulary. That's another really important piece. You don't want to buy a plan where it doesn't cover your $600 medication, right? You're going to pay the out of pocket. Those are the two most important things. But yes, if someone says, if I were to get cancer, here's where I'd want to go, we can check. And on many of those hospitals, we may even already know that information is easy to Google or to call, and we can make sure that that option is available to them. The thing that happens is people don't know this. They see a commercial or they get an advertisement, they call and they enroll direct. Now, not only do they not have a resource for those questions when they come up, but when your lab facility submits a bill with the wrong billing code and all those bills get rejected and they come in the mailbox and you think, I thought I had coverage, why am I getting these bills? Who are you going to call? Do you call Medicare? Do you call the insurance company? Do you start with your doctor, your pharmacy, the lab company? People don't even know where to begin to fix very common hiccups that happen with Medicare on the back end. And when you have an agency that specializes in Medicare and provides that back-end service, they're going to be a very good resource to you because those things will happen. And you want to have someone you can call who's going to be able to either know the answer or help you get the answer in a timely manner. And
Right.
those are the types of support that you want. And the sad part is, unless they listen to a podcast like this one, they may not even ever know that they gave that up simply by enrolling in a plan directly with an insurance company. They're not even aware of what they missed out on. And so I love appearing on a podcast like this one to sort of spread the word about why it's so important to have someone to help you on the back end. And of course, this service of an agent is free to you.
Yeah.
Agents get paid like us. We get paid a commission by the insurance company you ultimately choose. So there's really no good reason for you not to take advantage of that.
Okay. Is there any type of person that you think can go online, research all this, and get a good plan themselves? Is there any circumstance where you think that is possible?
For sure, there are going to be people out there that will do more due diligence than others. And could they figure out the problems on the back end? Yes, they could. Would it take them a lot longer to do so without that knowledge that we have on the back end? Yes. So one of the things I often point out to people who enroll through our agency is we have two teams. So we have this one team that explains Medicare upfront, gives you all the education, answers your questions, and helps you make an initial plan selection. And then once you're a client, we actually upgrade you to a different team, the client service team. And that team has all the same training as your initial team, but they also go through over 40 hours of training with us every single year on all of the problems that could and do happen on the back end. So if someone's bills get rejected, what do we do? What of the 70,000 Medicare billing codes, what is the code for XYZ illness at this whatever? Those are the kinds of tools that no matter how much research you've done, unless you have spent years solving these problems, you're not going to know how. And so could a really smart person figure out the problems on the back end? They could, but there's zero benefit to them for enrolling direct. Zero. Their premiums are not lower.
Well,
They're not saving any fees. And so
no, I get that. Let's step back on the zero cost to them, because whenever someone says there's zero cost to you, you know that's not true. There's always a cost. So what I'm assuming is that you get paid by the insurance companies.
Yes.
Of course, the premiums are taking that into account, right?
Yeah.
So people are paying for your service, but they're paying it through their premiums. They're not handing you a check for your service.
That is actually true. And you will, if you choose to enroll direct with a carrier, you still pay that. The carrier just keeps it.
Exactly. So there's no reason to not use somebody that's an expert.
Yeah. But you can see why people would. You can see why people would be hesitant, right? Like, what is this person getting out of this? And why would they want to give me that ongoing support? You know, that natural hesitation and getting those questions answered up front are really important, because you want to feel confident about ultimately what you choose.
Right. So if someone chooses not to do it because they think there's hidden costs, well, they're paying it anyway, and the other people are getting the advantage of it and they're not. So, okay, something else came up in my mind. You use the word travel, and I want to clarify. I know part of it is that some people think they're never going to want to travel to another state to get healthcare. But what's the difference between having a Medicare Advantage and a original Medicare AB? If you're a traveler and you travel overseas, every year you go on 2 trips. And I have a lot of clients that's what they do in retirement. They travel.
Yeah.
Is there any difference?
Yeah, there is. So here's my advice on that. Original Medicare doesn't have coverage for you outside of the country. There are some very limited exceptions. For example, if you were on your way to Alaska, traveling through Canada to get there, and you had a heart attack and the closest hospital was a Canadian hospital, Medicare might pay for that bill. There's no guarantees. There are just some limited exceptions that might be made. So if you're someone who's just traveling in the US, not a problem. If you have original Medicare and Medigap, you're going to be covered anywhere you go. There's no network. You're covered nationwide. If you have a Medicare Advantage plan, you also have worldwide emergency coverage. So in the event of a life-threatening emergency, you're bleeding or you have a something has happened, an accident has happened, and you could die without treatment, you would have worldwide coverage for those kind of emergencies and really urgent care. But what we see people run into is the hospital in the foreign country doesn't want to bill the United States. So they don't want to bill. They're very uncertain about billing a Medicare Advantage plan. So a lot of times they will ask you to put your bills on a credit card. And then when you come back to the States, you're filing claims on the back end. That's another thing an agent can help you with, but you're filing claims with your plan to get reimbursed. If you did a original Medicare and a Medigap plan, there are certain Medigap plans. Plan G and Plan N are the two most common Medigap sellers, and both of those have a foreign travel emergency benefit, but it's a limited benefit. So it's going to cover you for the first 60 days that you are out of the country, and it is a maximum $50,000 benefit. So there's a deductible up front. I think it's $250, and then the plan pays 80%, you pay 20%, but the plan will cap out at $50,000. So if you're going overseas for a week,
so, hold on. So if you're only going on a 3-week vacation to Europe, that's fine.
You would have that coverage. You would have coverage up to $50,000. Your other option is to purchase a short-term travel plan, and they're so easy to find these days. You could go to a travel agent. Those have traditionally been always the people that sell them, but you could also just Google short-term international medical plan, and you can buy all sorts of insurance that is additional coverage beyond what you would have. Maybe you're worried that $50,000 wouldn't be enough. Or maybe you're worried about, well, I want coverage if I get the flu in Europe, not just medical emergencies.
Right.
There are plans that you can get that will provide that coverage now, and they're relatively inexpensive. So especially if you're going to be overseas for a while, I do recommend picking those up for travel.
Okay. So that's good to know. Mm-hmm. Okay, great. Okay. So I want to switch gears, and we were talking about the person who is just starting Medicare. Let's talk about a person that's, let's say, 72 years old, got on a plan at 65, is single, doesn't have a spouse, doesn't want to read about it every year, an open enrollment, and just renews every year the same exact plan that they started with. What could go wrong?
It happens all the time. And the main thing that goes wrong is simply that your premiums get high. So, if you start off with a Medigap plan and you never change that plan from 65 to 80, you might start off paying, depending on where you live, $100 to $200 a month, let's say, and you might be paying double that by the time you get into your 80s. So healthcare has inflation just like everything else. Medicare raises the deductibles, copays, and coinsurance on their plans every year. And so the plans that supplement and pay those things for you naturally will have rate increases. So if you're healthy, then every year when you get your rate increase letter, you should be calling your agent and saying, I have a plan G. Can we shop to see if anyone else in my area has a plan G for less? And you can switch. And I have clients that have done this for years and they're still healthy enough and we can switch them. But maybe now, a lot of times when we find someone that's in their late 70s or 80s and they've been on the same plan for a while, sometimes it's because they now have developed a health condition that makes them ineligible to switch because of the underwriting. Those people, they can just keep paying their premiums as long as they can afford them, but they're still going to want to shop their drug plan every year because Medicare Part D drug plans change every year. They can change their premiums, their deductibles, their tiers that the drugs fall in. They can change the copay or coinsurance that you pay for the tier, and they can add or drop medications. They can also change their pharmacy networks. So you might love your Part D drug plan, but that drug plan is going to send you an annual notice of change packet in September, and it's going to tell you the important things you need to know about what's changing in the plan they roll out for next year. A lot of people don't get very excited about a packet from an insurance company arriving in the mail. They put it on the desk or kitchen table. They don't think about it. And now in January, when they go in to fill their medication, it's $400 because the plan has been dropped that. Well, you can't change your drug plan again until the next annual election period in most circumstances. So even if you're a set it and forget it person, you could do that with the Medigap plan, but that drug plan really does need to have an annual review.
Okay, good. Okay, thank you. All right, so your book about the 10 most costly mistakes. In some of the time we have left, could you just bring up a few that you see most often?
Yeah. So we talked earlier about the big mistake, which is being unaware that you only get one shot at the Medigap open enrollment period, that 6-month window. The other piece of that mistake is that when people hear about this annual election period in the fall, October 15th to December 7th, you'll hear some companies will call it annual election, some will call it open enrollment, fall open enrollment. That sounds like you could make any change to any plan. And so it might sound like that's a time when you could go out and get a Medigap plan with no health questions. But that is not the case because that annual election period doesn't have anything to do with Medigap plans at all. It's for changing your Part D drug plan or a Medicare Advantage plan if you have one. Well,
Okay.
why would they need an annual election period? Because both of those products have no underwriting. So you can for sure sign up. And if they didn't create an annual election period, everyone will wait to sign up until they got sick. And then all the companies would go belly up and none of your claims would be paid. So just like with the ACA coverage, they limit you to getting in the fall. That same thing happens with Advantage plans and drug plans, but don't mistakenly believe that you can use it to get a Medigap plan. You cannot. Another one that as we cover in the book is your creditable coverage proof from your former employer. So when you finally retire, you will get a last little piece of mail from that insurance company that covered you for however long while you were working for your employer. And this will be your creditable coverage level. And it will say, Cathy, you were covered from 1992 to 2024 on this XYZ insurance company plan. This is your credible coverage letter. Well, people don't know what it is. They shred it, toss it. They don't realize it's an important document. Why would I want to know why? Of course, I know I was covered. Well, you want to hang on to that letter because if you delay enrollment into Medicare because you're working and later on you then go and decide to enroll, you may have to, your insurance company for Part D may require you to provide proof of your coverage so that they don't assess a penalty for why you didn't enroll when you were 65. Now, sometimes they don't ask for, a lot of times they don't ask for that letter. They will just take your sworn testimony that you have it. But the way they verify if you had the coverage is that when you finally enroll in your Part D drug plan, if you're over 65 and you're not in your initial enrollment period anymore, they're going to mail you a letter that says, hey, we see that you're 74. And we need to know, did you have any drug coverage between the time you turned 65 and now? And they'll give you a whole list of reasons, and you need to indicate which reason you had or how you had the other creditable coverage. And you need to either call the Part D company or mail that back in. And that's how they let Medicare know not to assess a Part D late penalty on you.
Oh
but what
God.
happens is,
know this.
yeah, hence the book, right? Because people are not aware of this. They throw the letter out, or what happens more often is they might even have the letter, but they're getting so much Medicare mail that when that letter comes in among 50 other pieces of solicitation, they toss it. They don't respond to it. Now they're being assessed a Part D late penalty, and they have to pay the penalty while they appeal it. So the appeal can take months. You definitely want to have an agent to help you with that. But during the whole time that you're appealing it, you have to pay the penalty. So it's so important that you, number one, save the credible coverage letter just in case they want proof. But number two, when you enroll in that drug plan, you should be stocking your mailbox every day, waiting for that letter to arrive to make sure that you fill it out. And when you fax it or mail it back, I would do it in a manner that you have proof. You know, you've saved your transmittal, or if you call in to verify, you write down who you spoke to and what day you called in. Make sure you have all that proof, because we do deal with a lot of people who end up with a mistaken penalty. They don't actually owe it, but it's because they never realized what that letter was. They didn't fill it out. And now they're paying a penalty for who knows how long until we can get it fixed.
So are most appeals successful in the end?
They are, if you truly have the credible coverage. They are.
Okay.
So they take a while.
Time consuming and a hassle.
It is, yeah. And it can take a few months for it to get resolved. And people are, of course, never happy about that.
Right. Okay. I want to expound on this. Let's say you have a self-employed person who's got their own health insurance, doesn't need to roll in Medicare. What could go wrong there? What do they need to make sure they do when they turn 65?
Okay. So if they are self-employed and they have a small group plan, not an individual plan through the exchange. We'll talk about that too. But let's
Okay.
say it's them and their spouse, or them and 2 or 3 workers. When your employer coverage has less than 20 employees, Medicare is primary. So you definitely want to sign up for both Medicare A and B right when you're first eligible in your 7-month initial enrollment period for Medicare. Because if you don't sign up for Part B, who pays the 80% now when you need an outpatient surgery? You do, because you didn't sign up in the piece of Medicare that would have paid it for you.
Okay.
So you need to enroll in A and B. Now, you probably can delay enrollment into Part D because I bet that small group plan has drug coverage built into it. And most group coverage is creditable for Part D. If for some reason the group drug coverage is not as good as what you could get on Part D, that employer is required to send you a letter annually letting you know that, so that you can go sign up for Part D because actuarially it's better. So for small employer coverage, that's the case. Now, let's say you're self-employed and you just have a plan through the healthcare exchange.
Mm-hmm.
In that instance, sometimes you may even have a really good premium because based on your income, you're getting a subsidy, which is making your healthcare exchange plan really affordable. Maybe it's even cheaper than what you would pay for Medicare, but that coverage is not creditable for Medicare. So if you keep it, and you keep taking a subsidy when you should have left and gone on to Medicare at 65, 2 things happen. One, once they find out, they're going to bill you for all the subsidy dollars that you've taken since you turned 65 when you stayed on the plan and you shouldn't have. And when you now figure it out and you go sign up for Part B, for every 12 months that you should have been enrolled in Part B that you weren't, you're going to have a 10% penalty added to your Part B premium for the rest of your life. So don't stay on an ACA plan to go on to Medicare. The only people that there is an exception for on that is there are very few people who pay anything for Part A, because Medicare Part A costs $0 for about 99% of people on Medicare, because that's the part where they were taking out the FICA taxes all those years that you were working. But let's say that you're an immigrant. You've been here for 5 years, you qualify for Medicare, but you don't have the work history. You didn't pay the FICA taxes. You were never married to someone who did. You have to pay for Part A. Part A is expensive. In 2023, if you have to buy it, it's $506 a month. Those people can opt to stay with an ACA plan as opposed to Medicare. And we just almost rarely run into them. So most of the people probably listening to this podcast will be someone with premium free Part A based on their work history, right? And so those folks, they're going to want to leave that ACA coverage and go to Medicare at 65.
Okay, so the person who has a individual healthcare plan that's not subsidized, are they okay to delay? But you're recommending still enroll in Part B no matter what. You're supposed to enroll in Part B.
Yeah, they're not okay to delay because later on, when they finally sign up for Part B, they're going to have a penalty.
Yeah.
And usually, if you're not getting a subsidy for an ACA plan, you're probably paying more for a plan with a $5,000 or $6,000 deductible than what you would pay for Medicare Part B, which has a $226 deductible. Part B is $164.90. We often meet people on a plan, if they're not getting a subsidy, they're spending $500 or $600 a month for a plan with actually where Medicare would truly be better coverage. And so that's why they actually want to switch. If they're not getting a subsidy, they're probably excited to qualify for Medicare and reduce what they've been paying for health insurance.
What is a special enrollment period?
Special enrollment period exists for a valid reason why you didn't get coverage that you should have gotten. So, for example, or it's also if you need to make a change to your coverage mid-year for a valid reason. So, the most common special enrollment period that we find for people changing from one plan to another is because they move. So, if you are moving from one state to another, and you have either a Part D plan or a Medicare Advantage plan, those plans are based on networks in the counties where you used to live. So you can qualify to change plans mid-year and buy a plan in the new area where you move because you moved. So you've got, I think it's a 2-month window, a special enrollment period to do that. There is also a special enrollment period for Medicare itself. So let's say you just enrolled in Medicare Part A because you were working for a large employer. And with large employer coverage, that coverage is primary and Medicare is secondary. So you signed up for Part A because Part A costs you $0 premium, but you delayed Parts B and D. because you don't want to pay premiums when you have group coverage already providing those things. When you finally retire, you have an 8-month special enrollment period to add Part B. Now, almost no one will wait the whole 8 months. They would go ahead and sign up right away because you don't want to be running around without any outpatient coverage for 8 months. But if you didn't know that, you would actually have 8 months to do that. And so there are a whole bunch of special enrollment periods. There's ones for disasters where if a natural disaster or FEMA emergency prevented you from making a change when you could have because your house was flooded or there was a tornado or a wildfire, there are special enrollment periods for things like that. And so anytime you're working with a good agent, they're going to know what special enrollment periods might exist for you and use those to the best of their ability for you.
Okay, going back to the self-employed person, you mentioned large employer. What about self-employed person? Can they use a special enrollment period if they don't want to pay
No,
Part B and D?
because remember, if you're working for the small employer with less than 20 employees, Medicare is primary. So now
Right.
you were supposed to sign up at 65.
No, I don't mean small. What if you're self-employed and you don't, it's not a small company. It's it's you and your spouse. Can they use the special enrollment?
No, because the group health insurance has less than 20 people on it.
Okay.
So small employer coverage, whether that's whether it's a 2-person group or a 19-person group, that coverage that you bought that is technically a group health plan is secondary to Medicare because of the size of the company.
Okay. Oh, and then, okay. So, and I'm talking about if you're on the health exchange.
Yes. So
then if you're getting what, and you're not getting subsidies,
right.
can you use special enrollment?
No.
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 Okay.
No.
Okay.
Yeah, there's no special enrollment period for that. If you're not getting a subsidy and you're on an ACA plan, you need to leave that coverage because later you're going to get a Part B penalty.
Got it. Okay.
Yeah.
Thank you. All right. Let's use the final minutes to talk about you have resources you could share. We'll put this all in the show notes.
Sure.
And also, how can people get in touch with you? I know you have a Facebook page, all those resources. Could you talk about those, please?
Yes. So a lot of great resources out there for people to learn Medicare. The first one for anyone is Medicare.gov. That website, in the time that I have been an agent, has come a long way, and now it is very informative. It's a great way and a great place to start your research right there at Medicare.gov from the federal government. For us, we're very easy to find anywhere. Boomer Benefits, it's boomerbenefits.com. We have a Boomer Benefits YouTube channel, Facebook, social media. All the handles are Boomer Benefits. If you go to our website, you can sign up for a free webinar where you will come live to online at a certain time, and I will teach a lot of the things we covered today. We cover all the most important things that everyone needs to know, and we explain to them all the things we talked about, the employer coverage and when and how to enroll. We cover Medicare Advantage plans, Medicare supplements, what to do if you have retiree coverage. So it's about an hour. That's a free resource. You can sign up for the webinar. Sometimes we have people take several of them so they can really learn it and they get it down and then they call in. Our YouTube channel, if you wanted some more Danielle Roberts in your life, you could go and see my talking head on hundreds of videos, and usually we keep them pretty short. So let's just say today we didn't get into a lot of how Medicare Part D works and you're curious about that. We have a video for that, so you can go and find those resources. But probably the best resource we have is if you go on Facebook and follow our page, we have a private Facebook group. It's called Medicare Q&A with Boomer Benefits. And you can join that Facebook group for free. You don't ever have to become a client. We have lots of people in there who have retiree coverage and are never going to need our services. But we have about 60,000 members in that group, and we answer Medicare questions in there 365 days a year. So you can post a question and either myself or one of my marketing team will answer the question for you or provide a resource. But the best thing about the group is there's so many knowledgeable people in there now. Many of them are clients too. They actually sometimes jump in in and answer each other's questions before we even get a chance. So it's a great way for you to throw a question out and get an answer from thousands of other people who are just like you on Medicare and had to face those same decisions that you did. And so that's probably my favorite part of the community and what it can provide to people. And then, of course, the book you can find on Amazon. We sell it cheap for $10 so that people can learn what they need to without spending a fortune. And that is 10 Costly Medicare Mistakes You Can't Afford to Make.
This is so good. Danielle, you are offering such an incredibly useful service to people. You really are. And just briefly, how did you get into doing this?
So my brother and I, we were entrepreneurial kids. We used to always be doing odd jobs in the neighborhood, trying to earn money. We were very industrious. And I worked in the staffing industry after college for about 10 years. And that whole time, I liked my job a lot, but I wanted to do something. I really always wanted to own my own business. So it took me a couple of years to find a field because I wanted something where I could help people. I wanted to be in the service industry, not a product industry. And I was looking for the right thing. And then a friend of mine actually had an interview come up for an insurance company. And he invited myself and another friend to it. And we went and we actually learned about how it worked. And I was like, here's the thing I'm looking for. I want to do this. People don't understand insurance. I'm going to get involved. So the first year or two, I worked with small groups and individuals, and I did all those types of plans. But what kept happening is after I would help someone, a few months later, I would get a phone call and they would say, hey, do you know anything about Medicare? Because my mom or dad or aunt or uncle turning 65 and man, this stuff is confusing. And so for a while we said no. And after we got the questions enough times, we started looking into Medicare and we realized it's a beast. And that's where we went down the rabbit hole. And here we are today where we don't even do small group or individual insurance anymore. It's just all Medicare because of that wave of baby boomers and the great need for everyone to have this information.
Excellent. Well, thank you so much for spending the time with me on Financial Finesse, and I'm looking forward to watching the recording. I learned a lot myself.
My pleasure. Thanks for having me.
Thank you so much.